So in this video, I'm going to talk about getting my wisdom teeth out, and yeah, so I didn't go to the dentist for like 7 years, and my wisdom teeth, I had to get all of them out, all four, 2 on the top and 2 on the bottom. What else? My bottom wisdom teeth were growing against my bottom molars and at a slant. So the area that the wisdom teeth jutted into the bottom molars was covered, and because of that, the bottom molars developed tons of bacteria. And even though I was brushing my teeth, the area where the wisdom teeth were covering the molars got like these big cavities on my bottom right and left molars. So it was really important that I get my wisdom teeth taken out. So today I'm just going to talk about like the procedure of getting your wisdom teeth out. So my doctor, I guess the place I go, they have somebody come in like once a month to do this. So it was like pretty busy in there, and they basically just had me sit down in this chair, and like a chair that like leaned back, like a dentist chair, and there's a few monitors, and the dental surgeon came in and he had an x-ray of my teeth on the monitor, and he kind of just explained to me all the nerves in my mouth and like what to expect during the surgery, after the surgery, and what the main objective of the surgery was. And then basically they just put this like oxygen tube on my nose, and then they switched it out to another one, and they put an IV in my arm that first was running water and it was really cold feeling, and then they started giving me anesthesia. And the doctor was trying to say like, what's your favorite vacation spot? And I didn't have one, so I didn't really have a good answer for him, but he's like, well, let's choose Hawaii. And then I think he wanted me, and then he said that I would like fall asleep and it would be like a dream, and then I would wake up. And that's pretty much what happened. Like I just like suddenly, I don't know, I guess it was just, I was sleeping, and then I woke up, and when I woke up I was like super groggy, and my whole mouth and my chin area was all numbed up because they had like some anesthesia. They basically just numbed up like my chin from like basically my whole mouth, and I couldn't feel anything, and my jaw felt like really heavy. And yeah, it was a weird feeling, like touching my face. I could feel what my face felt like with my hand, but I couldn't feel it was weird. It was like touching somebody else's face, because I couldn't feel my hand touching my face, but I could feel my hand. I couldn't feel my hand on my face, but I could feel my face on my hand, which is a weird thing to say. And they put some gauze, like this big like wrapping stuff, like in my mouth, like over where the holes were, where the molars were taken out, so that it would stop the bleeding. And then this woman came in after the surgery, and she started telling me that I just need to relax, don't talk, because I have the gauze in. And then she just started explaining different things. I don't really remember what she was explaining, but I remember asking, like, I was trying to convince her to like give me, I wanted the teeth that they pulled out, like I wanted the molars to keep. So I was like, how can I like get a hold of the molars? I just want to keep them for personal reasons. And I think she thought that was kind of funny, because she started laughing, and then she's like, you just really need to stop talking, because you have the gauze in your mouth, and we don't want your teeth to like bleed. We don't want your mouth to like bleed everywhere. But then I just kept asking for the molars, and then and then I knew that the surgeon had come from another area to do the procedure, so I started asking her like, oh, are you with the surgeon? Like, where do you live? where are you from, blah blah blah, and like all this stuff. And then she like wheeled me out to the car. And another thing is, when I got the surgery, like they don't allow you to get the surgery unless you have a designated driver. So you have to have somebody like in there with you. So my mom had to come, and she couldn't leave the building. And then so she drove the car up, and I walked into her car, and I was really kind of like loopy, but I don't know, I still felt like I probably could have driven, even though you're not allowed to. I didn't feel like I was that out of it, because my mom was like, oh, like, you won't remember anything, blah blah blah, and I like basically remember like everything from when I woke up. Yeah, and then it was really annoying because my my mouth was all swelled up, so I couldn't like feel that. And then I kind of I was like awake, and I like when I got back home, and I was fine, and I have to eat like only fluids, or I can only ingest fluids, because they stitched up the wisdom teeth where the holes were. So I have to wait for the stitches to heal and then dissolve and close up before I can eat solid food. So so that's kind of weird. I've just been eating like pudding and ice cream and applesauce. I expected that my jaws would like swell up a bunch, because I've seen people like after they get their wisdom teeth out, and they look like they have a chipmunk face, and I haven't got that at all. Like my jaw right now feels like a little heavy, and this is the day after the procedure, and I'm like driving. I don't need pain medication. I took some Tylenol, but I don't know. And my jaws haven't swelled up at all. And then another weird thing was, so when they first make you sit down in the dental chair before surgery and you're reclined back, they have all these monitors, and one of the monitors, they monitor your blood pressure, and then your heart rate beats per minute, and my heart rate beats per minute was like super low. I did not expect it to be that low. It was like 42 beats per minute, and then occasionally it would like dip to like 39 beats per minute, and then I would get there, it would show this like red flash on the screen, and it would show red text, but I think it would say like dangerously low. But I used to be an endurance runner, so I guess that makes sense. But I don't really I exercise because of my job, but I don't really and I do go skateboarding, and sometimes I go mountain biking, but I'm not I don't consistently do things. I guess my job, but that's not really endurance, it's more like strength. So that was interesting. My heart rate was 42 beats per minute, and all the way down to it was between 39 beats per minute and 46 beats per minute. And then I was there's no way. So I actually counted, and it was pretty right on. I think when I counted it was a little higher, 47, 46. But I also was kind of laying down too. So I bet if I stood up, it would probably be in the 50s or whatever, or low 50s. But who knows? I just found that to be interesting, especially because I have anxiety, and a lot of people who have anxiety, they have their heart rate gets jacked up when they get anxious, and that doesn't really happen to me, which I think is why my anxiety is more cerebral and more OCD rather than physical symptoms, which makes it even harder to control, I think. But I'm gonna do a video about that. I've never heard anything like that, but I don't know. Maybe I'll do some research and do a video. I probably won't do the research. I'll probably just do the video, because I don't know. Sometimes when I do research, I just feel like I'm reciting stuff that people could just look up on their own, and it's just not interesting to me. And all the channels that I watch aren't channels that they're more entertainment or something that I can apply, applied knowledge. So something they tell you this is how you do that, and then you just go and do it right away, rather than learning theoretical things, or things that you can't see with your own eye. I don't know, some of the mental health stuff, it's this is what's happening in your brain, blah blah blah, and it's like, well, that's great, but like it's hard for me to like relate that to like how I'm feeling and what I'm doing in the moment. So I used to kind of like think like, oh, these like psychologists that are saying all these like diagnoses from the DSM and all these like studies, well, like they're so smart, they must be right. But now I just kind of think like, I don't really care about any sort of study. Like I've known about studies and all this crap, and I've tried a bunch of stuff for anxiety. Nothing related to any sort of study has helped me. It's just like, it just like puts you in this rabbit hole of reading like really boring like academic material that's just like, I don't know, like the control group, blah blah blah. Like I don't care at all about any stupid control group. Yeah, so that's it with that video, this video.